better?
I feel a lot better because the week before Thanksgiving, I had an awful time
Right.
because I was on those antibiotics. And they gave me diarrhea every day that I was on them. Bad diarrhea.
I'm sorry.
I was so tired, I was gonna come to the hospital. And right when I was gonna come to emergency, because it had been going on so long, and I can finally get the strength to get up from it, it stopped just like that. The last day I took those pills, it just stopped.
Okay.
And I said, it's that medicine.
Mm-hmm.
Oh, I was so miserable.
Sorry. How's your breathing and cough?
Oh, that's good.
Good.
I'm doing good on that. I just have the mask on in case there's some germs around.
Sure. Yeah, me too. I have a little bit of sore throat, so.
Mm-hmm.
So that from both of you all.
Right.
Okay. So this is where we are now. I tried to be here with Dr. Harrington, but he has a couple people ahead of you, and then I have some after you. So that didn't work well. So basically, we were concerned you're due to have a CT scan after a certain number of treatments, and we did chest x-ray to see if you have any pneumonia. And that says yes, and then they're concerned some nodules or little changes in the x-ray. So we moved your CT scan. In your lungs, the nodules hasn't really changed. So whatever x-ray shows probably was kind of mixed with a pneumonia or something. So from the CT scan, no acute changes to be concerned from the cancer perspective, which is good news.
Yes.
But it seems like there are some changes. Your pancreatic mass is stable. It hasn't really changed from August. That's good. Your left adrenal gland that has thickened, still there.
Say again.
So we've been watching few areas. So pancreatic mass is stable. The left adrenal that has some uptake, that's stable. Hasn't really changed, I think.
Does opaque mean thick?
So the adrenal gland, what they said, it's a nodular thickening.
Okay.
That has some activities in the PET scan. So we're assuming there can be a cancer portion there.
Okay.
But it doesn't sound like it's been changed.
Okay, so that's stable as well.
The mass in your left pelvic area, that's grew in size. That explains why you have more pain, etc. Right lower quadrant, that seems a little bit smaller, or so they show us like kind of a 3-dimension. One dimension is slightly smaller, so it was like this to this. Does it make sense? So I would say more or less it may be about the same. And in your peritoneal area, in the right, lower abdomen. So the peritoneal is the area between your organs and the abdomen wall. So it's kind of space between, and we call it peritoneal. There is some deposit in there. It's 9 millimeter, about 1/2 inch, a bit smaller than 1/2 inch. That's new. So in the space between the organs and your abdomen wall, there are some changes. So in general, that's kind of new, but we cannot say this is a lot worse compared to, I think, the last one. So my role is mostly help your symptoms. I cannot make decisions for your treatment. And unfortunately, the timing wise, Dr. Burroughs left, who knows your condition the most, she's gone. So we're gonna reschedule you with Dr. Atella on 17th. We tried to move your appointment sooner with him, but it didn't work very well. That's why we have you come in. Anyways, you need to see Dr. Harrington for general symptom management as well. He wanna talk to you, and then we have another physician came in meantime. He was supposed to start sooner, but anyways, there was some paperwork. Anyways, he can see you next week. He is more specialized in GI, like pancreatic cancers and etc. So I'm gonna have him to see you next Tuesday instead of waiting another 2 weeks.
And what is his name?
Syed, S-Y-E-D.
S-Y-E-D.
Yes. So what I'm saying is we're not giving you the treatment today because you kind of technically finished your last cycle. We skipped a few because your blood count was low, you had infection. We didn't feel comfortable to give you more chemotherapy because they will make you sicker. You know, we're gonna have your blood work today, see if you need anything else.
Yeah,
Last time your blood count went up. I'm talking about the hemoglobin went up and then it's down, very last one, but it's not super low to give you any transfusion. I'm glad to hear that you feel a bit better than before Thanksgiving.
I feel a lot better.
Yes, and I'm glad that you have you felt good to have a holiday with your family.
Mm-hmm.
You know, we don't want you to be sick.
They were all sick.
Oh,
Yeah.
The whole house. We had to do Zoom.
ouch.
I was the only one getting well on antibiotics. They had to go to emergency. She was sick downstairs. The baby was sick. My other sister was sick. It was just, my niece had to go home. She was spending the Thanksgiving, but she threw up. She was sick. Oh, they were vomiting.
Oh my goodness.
I said, let me stay away. I stayed away from them. They were sick.
Oh my.
So I won't get a chance to see them until this week probably.
Oh, you can have late Thanksgiving party.
Well, we had all the food, the trimmings and everything. We didn't care about Thanksgiving, just to be able to be with each other, because we don't too much celebrate holidays anymore.
I was just thinking about you. I didn't think about the rest of
I
us.
stayed, me and my husband, we stayed
Okay.
home.
All right.
So we don't want to be around now.
Okay. Other holidays coming, so still. Okay, so that's the plan for today. Do you feel like you need some hydration or
The
anything
plan
else?
for today is to
Blood work. You're getting blood work today.
Yes.
So that's
I'm just getting blood work, no treatment.
no treatment.
But how is that affecting, delaying my treatment on my cancer?
So the discussion you and the doctor's side will do is he's gonna compare all the scans and kind of think about the treatment options.
So I'll be going on a new treatment.
That's you and he will decide
No,
to do.
because this one is seeming like it's stabilizing. Let's keep on with it.
Right.
Oh, I miss my Dr. Burrell. I wish she had waited till December to
I'm
leave.
sorry.
Somebody can call her up.
So this is a little bit more complicated to make a decision than very first time.
How come?
Because you did, I think, at least 4 different types of regimen so far, right? So I don't know the conversation between you and Dr. Braille. So as you said, that this treatment kind of stabilized your condition. I think the last time you progressed pretty fast,
Right.
and that was most aggressive. And then you had a lot of symptoms.
And then my stomach started
Right,
going down.
really like blowing, and you didn't really feel well compared to the previous times, you know. Unfortunately, we cannot completely control the pancreatic cancer. We try to stabilize it, as you said, that's very important, and then try to keep you feel kind of okay. I cannot say will make you feel well, but make you feel okay to do your routines as much as you can, enjoy time with your family. I think that's very important. After a few lines of treatment, unfortunately, we are kind of trying to stabilize the disease. We cannot completely cure it. At this time, you know, we kind of exhausted a few options. We are having less options. Meantime, you're getting a little bit weaker over time because your body can take it up to so much. You know, so we try to make the best choice to make you feel okay and control your disease, kind of stabilize your disease, you know. So they have to review, doctors have to review all of your chart again, see where you are. That's why we need your blood work, and then consider your clinical condition.
It's like being at stage 1 again.
What do you think?
Oh, well, I mean, if that's the way we go, that's the way we go. I mean, he has to do his analysis.
Yes. Any pain besides this?
Oh, no.
New pain, headache?
No, I had headache and all that while I was sick, but I didn't do too bad when I was had pneumonia. I didn't even know I had it. I didn't have fever.
Right.
I didn't have a lot of the symptoms that you would think. I had that cough, and I can feel it down in my stomach then, but now I don't. I might be dehydrated some because my lips are peeling, but that's about the only thing.
If you're drinking well, I think that's good. If you want to, we can give you a hydration.
Past that,
Okay.
I feel good. And my watery eyes, that was a thing. My vision is messing up.
Oh.
My eyes water so much, sometimes it be dripping.
Oh, okay. Is this something new or is it getting worse?
This is something new.
Okay.
One night, they was watering so bad I had to close them. And just start wiping them, dabbing them dry.
Okay. Do you feel itchy?
No itchy. Not like pink eye. No scratching. It's just water. You be watching TV and all of a sudden water just dripping down from it. And I have to put a napkin there, a
Okay.
tissue, to keep it so I can watch TV.
Okay.
Don't let this one start watering. It'll water so much, well, it'll run over on this one. I noticed that. I said my eyes are watering too much. But past that, and my hip hurting, but that's normal. When I take that medicine, it stops. So I have a pill to take. I didn't take it this morning 3 times a day. So I have pain from my back all the way down to my ankle.
Is there any reason that you didn't take a pain medication when you're coming here? You didn't take a pain medication this morning when you're coming here?
I forgot I was taking so
okay.
much. I had to take my medicine for my sticking of the clots. Then I had to take my cancer medicine. Then I had to take my neuropathy medicine. So I just forgot to take the other tab.
Oh, did you take a CAPE, the cancer medication? The cancer medication?
No.
Well,
Okay.
you said you took your cancer medicine, so she's asking which cancer medicine did you take?
Oh, my breast cancer.
Oh, you were
MSC.
hormone. Okay. All right. Because you're supposed to have two. I was
Right. No, I didn't
confused. Okay.
take them 3
All right.
pills.
Yes. Thank you.
I wouldn't have took them till I got home because I didn't know if I was having treatment.
Right. That's correct.
Yeah,
Yes.
so I wouldn't
Yes.
take. Normally, if I was having treatment, I would take the pills.
Right.
Before I got here.
Yes. Thank you.
Yeah. No. I didn't take them. I took that MSC.
Okay. Do you have any runny nose too?
Yes.
Okay.
I got a bunch of tissue in my pocket. Yeah.
Okay. Any cough, shortness of breath?
No, very little cough and no shortness of breath.
Okay.
That would have scared me.
How's your stomach?
So,
Nausea, vomiting?
no more since that first time.
Okay.
Thank the Lord. That was God awful too. Ugh.
Any change in your urination?
Well, yeah, because by me being sick, I was trying to drink, so you want to drink as much as you can. So I was going to the bathroom.
Okay. But you don't feel like your belly's pressing
Oh no.
anymore?
No.
Okay. Yes. Okay. Good.
No, I'm just hoping that we could keep going so it could go down some more. Because the treatment was working, it was just, I guess, my blood cells. So we'll have to see what they look like now.
Okay. So I'll talk to Dr. Side, kind of give him your history, and see how you've been doing, what you want. So you and he have a good conversation next week. So I see he's open on a Tuesday, 10th. Next week. He has a clinic in the afternoon, so probably you're gonna see him at 1:30.
Oh, okay. Tuesday at 1:30. That's a good time. Maybe early in the morning.
I'm canceling your CT scan that we scheduled before. Because you just had it. Yes, we're supposed to cancel when they scheduled you, but they didn't, so I'm gonna cancel that. Okay?
Overall, the CT scan looked pretty good. It sounded pretty good.
So it's some changes, but compared to the very last one, not a whole lot. I think the most concern we had was your lungs. But I'm glad to see that there is no evidence of cancer in your lung. From the x-ray, they kind of
There's no what?
no evidence of cancer in your lungs. So no. So X-ray, they did X-ray, mentioned the pneumonia and mentioned nodules. That's why we kind of moved your CT scan sooner.
What about the liver?
Liver. Some they didn't say anything good.
So that's a lot.
So I'm thinking that it's stable. When good means gone, but stable. It hasn't. The lesions haven't grown anymore.
So one part is a little bit grown.
Okay.
That's the 1 inch you were talking about.
Okay, so I cannot show you the picture itself. So basically the pancreas mass started. It's been stable since August.
Thank you, Lord.
The uterus, there are some fibrosis, and then there is a solid cyst in your left pelvic area that we know that's grown. That's enlarged in size, about 1 inch bigger. So again, 3-dimensional. It's a little bit bigger like this. And right lower.
No wonder I feel that little twinge right there.
So the right lower side, there is one. So it was like this to this. Does it make sense? So probably height is a little bit shorter, but it's a little bit wider. More or less, I would say it's kind of
flattened
about
down,
stable. And the peritoneum deposit. So we call it peritoneal carcinomatosis. So there is some kind of jelly form of things. It's kind of cancer in the space.
And where's that area at?
So that's in the lower abdomen.
The lower abdomen
area.
Okay.
So between your any organs and your
Probably
abdomen wall.
I feel a line of something.
So when you have really like extended the abdomen with the ultrasound to see if there's excited, if it's a fluid to remove, but there was actually kind of jelly-like form, so they cannot remove it. Unfortunately, the pancreatic cancer can go to the third phase, make a kind of jelly type of thing.
So that's nothing unexpected because it happens and
Right. So they see kind of a new deposit, but yeah. Well, that's a bit worse in the interval. So kind of in terms of stabilize your condition is, unfortunately we cannot cure you. We just treat you very chronic illness.
I understand.
So unfortunately what we do kind of slow down the prognosis progression. Still, I think that's pretty good outcome.
Oh yeah.
And then keep your quality of life meantime. So it's very difficult to keep the balance between because your body's been gone through a lot, and then little by little you're getting, you went through a lot. You did really, really well. And you have a really strong mind, high spirit. I think that really helped you gone through well, but your physical condition can be weaker every day. And also we're getting older every day. So without this, it's not the same as yesterday in general, right? But you're going through a lot, mentally, physically, emotionally. So whatever we do more, it's gonna make you weaker little by little.
I understand.
Yes. So the conversation will be long and deep, but certainly he will respect your wishes. Like if you want to continue, if you want to try a little bit more of this treatment, I think that's still valuable, and I have a scan soon.
Yeah, I want to keep going as long as I can. And I don't feel weaker. I felt a little tired, but I guess it was due to having the pneumonia.
Right.
But past that, I feel
Yes.
I feel well.
You recovered pretty well from that.
So I'm glad it looks a little good. I'm glad there's no cancer in the lung.
Right.
Because it was something going on up there, so that's good. Help that. So breathing is good. I don't complain about that, but I did feel that little twinge. So I guess and then as far as the jelly, I feel a line in my lower stomach. It's tender down there, and that's new. So that's probably it. So that I'm good with it. You okay?
No, I'm wonderful.
But I'm good because
because it's about you, so
because it's a good report to me. Even though we have those things were expected to happen, but to have no cancer and not to have the liver. So now we just working on the pancreas. I had 3 things wrong with me.
You have a lot going on, that's for sure, but they don't want to, make you sicker.
Oh yeah, I understand.
So
I need the whole body to hang on.
Right. Whereas you have a strong mind, but your body control the head, the butt follow. So, So it's all about you, honey.
But I feel good. I feel like mama for some strange reason. And I can't shake that.
Yeah.
That's the only thing. I feel like mama. I look like her. Or I put myself together, my natural self is like mama. Not stroking mama.
Well, I know what you mean. I understand.
I feel just like her. But other than that, I feel good, Dr. Song. I'm not complaining. Y'all did a wonderful job.
Thank you.
Keeping me alive. I never thought I would be here.
Again, you're doing really good.
When he gave me that diagnosis that day, I could just give it to the Lord. That's all I could do.
Yeah.
And between him and y'all, I'm still here. So I'm thankful to the Lord, and I'm thankful to y'all for keeping me here. Because I want to be with my family long as I can. They know what the end outcome will be. But how we handle it is a big part of living. Instead of moping, you got to go on and be grateful for each day. So I'm making it. I'll be here for Christmas. I feel really good to be here for eat again another good holiday. Well, not so much a holiday.
Hope your other family are good. Your other family are good.
Oh yeah.
To enjoy.
Oh yeah, they're a bundle of fun. I love each and every one of them.
Yeah.
So right now we're just gonna get the blood work. So
And then see Dr. Harrington.
yeah.
See your colleague, and then we out of here.
Yeah. So then.
And I can go get me some pancakes and bacon.
Oh, I love that. I like the plan.
Okay.
Okay.
Yeah.
Thank you, Ms. Peterson. Thank you.
Thank you, Dr. Song. I really appreciate you.
You are a strong God's
With these
child.
old legs.
My son, we're not very religious, but we still go to church. I had to admit that. And my son said, I'm God's child. Dad, you're God's child. Are we brothers? Maybe.
Oh, yeah.